Hi, I'm Molly. I'm one of Dr. Biesman's nurses. I specialize in injectables as well as many of the other cosmetic services that we have available at our office. I'm here today to talk to you about the overall rejuvenation of the lower eyelids. Oftentimes people come to us seeking advice and guidance on what they can do to improve the appearance around their eyes. There are several options that we have. One of them is a surgical approach. The second one is injectable fillers. We also have a third of laser resurfacing and a fourth of neurotoxins. It often depends on what each individual has going on, but we'll go over kind of a combination of all the things that we can do. The first thing is from a surgical aspect. For people who have the puffiness to the lower eyelids, that often they come in and they say, I've got these bags under my eyes and I don't like them. Some of that is herniated fat. The eye is cushioned in fat, so sometimes that fat will kind of push its way forward and it just sits there heavy. It's often genetic, and the only real way to get rid of that is to surgically go in and remove some of the fat and then redistribute some of the fat to kind of smooth the transition from the lower eyelid to the cheek. You can also use injectable fillers for people who are not quite ready for a surgical approach yet, that want to just soften the appearance of that puffy under eye. They often have a demarcation line where that puffiness stops and the cheek begins. You can inject what we call the tear trough there to soften that transition from the lower eyelid to the cheek, just to where you can kind of mask some of that puffiness. We often can't fully correct that, but it helps to soften that until people are ready to take that surgical approach. The third thing is the laser resurfacing. People often are concerned about the crepiness or that tissue papery texture to the skin when they smile. Surgery is not the answer for that. We typically will remove a little bit of extra skin if there's enough laxity to the skin surgically. But it also needs to be addressed from a matter of loss of elasticity and breakdown of collagen over time. So that's what causes that skin to kind of create that crepe papery appearance. So laser resurfacing allows us to actually drill little tiny micro holes into the skin to stimulate the body to repair that skin and to build new healthy collagen and elastin to improve the overall texture, tone, to help to tighten that skin. The other thing that we can also do that helps with the overall appearance of the eyes is neurotoxin, either Botox, Dysport, or Biesman. Those drugs actually help to soften the lines around the eyes by way of just relaxing the muscles. You can also inject in the lower eyelid, the muscle that actually squeezes the eye, little tiny doses of Botox or Dysport or Biesman to help to relax the muscle, so that way when you smile, some people have the muscle actually bulges some there to help to soften the appearance of the overall eye itself. So typically we go at things from a comprehensive approach. There's not one quick solution to solve every situation that you've got. Our goal is just to teach you what's available to you and how our thought process is working through this, because our ultimate goal is to where you're happy, to where we're happy, you got the outcome that you wanted, and we were able to provide that to you. If you have any questions or if you need any additional information, please don't hesitate to give our office a call. We'll be more than happy to help you any way we can.